Morning everyone. The average person actually knows very little about acupuncture, so this video is about 5 minutes long and it's just an explanation of what will happen on your first visit. It's actually really easy. It's so easy. So you arrive, we've got a coded entry system, so when you come for your first appointment you'll know what the code is. If you don't know what the code is, just ring the bell, we'll let you in. I'm in the waiting room now, you can't see most of it, but come through and wait in here and I'll call you through into my room when your time has come. And we sit down and I'll fill out a case paper. Now sometimes with some people I only need to ask one question and I know what I want to do. Other people will need to go through the case paper. It depends how complicated and chronic your symptoms are. So maybe the case paper, sometimes it can take 20 minutes. So for anything from 2 minutes to 20 minutes. After the case paper is taken, then we need to do some diagnostics. If it's soft tissue injury or some kind of thing that is necessary to do some physical palpation, then I'll quickly do that. Likely you'll be standing up. You won't need to take your clothes off. After that, then you lie down. And this is when we start the probably, well, I was going to say most important, but it's an important part of the whole procedure. It's the diagnostic. And the diagnostic, the purpose of the diagnostic is to confirm what we've discovered in the case paper and to give an energetical diagnosis. So I diagnose from the pulse, which I've made another video on. If this is interesting to you, you might want to scroll back in my blogs and have a watch of this video, this pulse diagnosis video. With pulse diagnosis, it's very ancient. It's an incredibly sophisticated tool that enables me to listen into the body, to tune into the rhythms of the organs, and to find out what exactly, in a very ultra specific way, what is malfunctioning. Now, you'd be amazed what you can feel on the pulse with pulse diagnosis. And I expect to be able to feel on the pulse whatever it is that you've come with. If you can't, or if I can't treat it, or it's incredibly hard to treat if you can't feel it on the pulse. So the purpose of pulse diagnosis is to confirm what we've discussed in the case paper. Pulse diagnosis is done when you're lying down on your back, and it typically takes me about 3 minutes, and then from here we work out where the needles need to go. Now I only use 1, 2, 3, 4, maybe 5 needles, and these needles, they can go literally anywhere on the body. It's not connected at all about where your particular pathology arises. Most of the points that we use are below the elbow and below the knee. So it's highly likely that you will receive needles there. And like I say, it could only be 1 needle. It could be 2. And I think at this point, patients are often surprised, especially if they've got a chronic condition that's very serious. I think that some people are inclined to think, you know, how can this help me? From a certain perspective, acupuncture is quite underwhelming. There's just 2 little needles. One might be in your forearm, one might be in your foot, and that's all there is. And maybe you're suffering from quite a serious disease like rheumatoid arthritis, and you think, well, how can this help me? And I suppose that's a fairly intuitive thought, but what patients don't yet understand is, yes, it looks underwhelming from one perspective, but from another perspective, an electromagnetic perspective, there's a large change, there's a large explosion that's going on in the body. So once the needles are inserted, you leave. I tend to leave the room. The needles are left in for 20 minutes and I'll put a blanket over if you want one, and you just have a relax. You can fall asleep, you can just chill out, you can think about what you're going to do after your treatment. I don't mind, you can do anything you like, but 20 minutes, and then I come back into the room, I take the needles out, and that's the treatment over. That's the whole process. It's so easy. Most people the vast majority of patients, perhaps even all patients, they love their acupuncture. Acupuncture on the whole, when the needles are inserted, it makes you feel really relaxed. So that 20 minutes is a lovely time, and it's a time that you can take out of your life, you know, because people on the whole are really busy, and you can just have 20 minutes to yourself and do nothing, and that's great. So the needles that have been taken out, and you get up off the couch, and then we come through, sort out the next appointment. If you're a new patient, maybe that will be in a week, maybe that will be in 2 weeks, maybe it'll be in 4 weeks. If you're an older patient, it's highly likely to be in 4 weeks. If I see you for prevention, the next treatment will probably be in 3 months, and then that's it. That's the whole process. I wonder if there's anything else I can add. I suppose, you know, if you're in any way nervous about acupuncture, please don't be. It's so easy. I treat children. The oldest patient that I've ever had is 100 years old. The youngest patient that I've ever had is 1 day old, and there's all the ages in between. You know, I regularly treat children, and they're absolutely fine with their acupuncture. You know, it's easy, you know, so don't worry. And if you have fears, then phone me and let me know. And thank you for listening.